In Thailand, the Thai people have benefited from the Universal Health Coverage Scheme for over a decade, since 2002. The UHC scheme has caused many changes in the Thai public health system so that all Thais can have access to standard health services according to the changing economic, social, and political context. In this regard, health personnel and agencies concerned, directly and indirectly, have to adapt themselves to efficiently implement the established guidelines. True success is not in the learning, but in its application to the benefit of mankind. Priority setting in University Hospital toward universal health coverage. Faculty of Medicine, Siriraj Hospital, Mahidol University. For over 127 years, Siriraj Hospital, officially under the Faculty of Medicine, Siriraj Hospital at Mahidol University, has been playing a role in the Thai society involving medical education, research, and services continuously, as it is the place of hope of Thai people from all walks of life. As there are a lot of patients attending the hospital each day, all personnel have to work hard and the patients have to wait a long time before they can receive the services. So finding ways to resolve such problems is challenging.
Associate Professor Cherchai Nopmani Jamlat Lerd, Deputy Director of Siriraj Hospital, said that our goal is to achieve maximum benefit through our limited resources of budget, personnel, and technology for the highest public benefit. Therefore, we must adjust and develop our services and education to best serve the public, utilizing Health Technology Assessment, or HTA, with highest emphasis on quality of services. Safety and cost were also additional considerations when making this decision.
At Siriraj Hospital, there are approximately 3 million outpatient visits and 80,000 inpatient admissions each year. And the numbers are very high, and personnel in all departments have to work with their full capacity. Blood examination is an important step for medical diagnosis and treatment. In the past, sending a blood specimen to the laboratory and getting the results took a long time, and a system analysis found that part of the time was wasted on specimen delivery. The adoption of the high-speed small pneumatic tube system for transporting the tubes of blood specimens has helped reduce the waiting time by 30 minutes. No need to send all the tubes at the same time as in the past, which had to be delivered by hand. Assistant Professor Satien Supanichanan, Chairperson, Department of Clinical Pathology, Faculty of Medicine, Siriraj Hospital. The blood sample collection room and the laboratory are about 400 meters apart. The development and installation of the small pneumatic tube system for high-speed transportation of blood specimen tubes at a speed of 7 to 10 meters per second has reduced the transportation time considerably. Regarding the workload, the system has spread the blood tubes that arrive at the lab each time, rather than sending a large number of blood tubes at a time as before. Under this system, the test results can be obtained more rapidly and efficiently. One important factor in medical services is adequate workforce and efficiency. Being seen here is the administration of pain relief medication for a patient after surgery, which has to strictly follow the established control procedures, as it is a high alert drug. The drug has been prepared by the pharmacy department in the form of ready-to-use injectable medication. In the past, doctors and nurses had to prepare the medications by themselves. Sometimes there were errors due to heavy workloads and urgency. Currently, the preparation is undertaken by the pharmacy department instead. Here is the pharmacy department at Siriraj Hospital. The step being seen now is the preparation of ready-to-use medications, especially high-alert drugs, which has to be carried out by skilled personnel. This is one of the important steps in medical treatment, as the patient has to receive a correct amount of drug with good quality. Aphirom Lau Jalern Kiat, Pharmacist and Chief, Sterile Drug Production Division, Pharmacy Department, Siriraj Hospital. Efforts have been made to produce drugs for patients in the form that is ready to use, as much as possible for patient safety. Our drug production process is based on the safety standards in the clean room, with a proper environmental control system. Anjalika Glin Niyom, Pharmacist, Sterile Drug Production Division, Pharmacy Department, Siriraj Hospital. We produce drugs to support the operations of physicians and nurses so that their work is more flexible and smooth as actually needed. We have drawn up drug production plans and get prepared in advance so the drugs produced and dispensed are most efficacious. Associate Professor Siriraj Nopmani Jamlat Lerd. Under this system, errors in drug mixing are reduced. So are medication errors. Importantly, the nurse's workload is reduced. Rather than spending time on drug mixing, they can use that time for patient care, which is more cost-effective. One of the important roles of Siriraj is the production of health personnel with good quality, based on the instructional concept that focuses on the development of model and method of students' experiential learning as much as possible. This is to ensure that upon graduation, the graduates will be able to use their experiences gained in a timely manner, resulting in people's access to quality medical and health services. What we are seeing now is sixth-year medical students performing obstetric and gynecological practices with mannequins, an important experience for the students. Assistant Professor Dr. Tripop Lertbannapong, Lecturer, Department of Obstetrics and Gynecology, Faculty of Medicine, Siriraj Hospital. The integration of theory into practice using mannequins here has helped students gain experiences, learn from mistakes, and solve problems. They can practice a certain procedure repeatedly so that they can remember it forever. The skills will make them confident in providing patient care after graduation. Besides, this is the Siriraj Training and Education Center for Clinical Skills, or SciTech, that serves both medical students and personnel within the country and overseas in sharing knowledge. This effort has resulted in the development of research activities, curative services, and health workforce in Thailand. Professor Suwani Surasera Niwong, Deputy Dean and Director, Siriraj Medical School. The Siriraj Medical Simulation Center for Education and Training, SIMCET, is the place for linking classroom learning to clinical learning with patients. Although its investment cost was high for system and equipment installation, and the instructor's workload is higher, it is incomparable when taking into account patient safety and the quality of care. We have to choose that option, which has considerably helped develop the skills for medical students. They can do a certain procedure repeatedly in a safe environmental condition. It can also enhance experience in dealing with risky situations, which should not be learned from the patient first. Another important role of Siriraj is the reintroduction of Thai traditional medicine in terms of education and services. Here is a study on medicinal plants being conducted by students of Applied Thai Traditional Medicine at Chalerm Prakiat Park, located on the grounds of the hospital. For teaching and learning purposes, classes and courses on Thai traditional medicine are offered in line with the context of modern medicine. Moreover, research and technical services related to Thai traditional medicine are also undertaken for the benefit of the Thai traditional medicine programs throughout the country. Associate Professor Tawi Lauhapan, Chairman of the Center of Applied Thai Traditional Medicine, Faculty of Medicine, Siriraj Hospital. We focus primarily on the production of personnel with capabilities and skills, and then develop Thai traditional medicine services. At the outpatient clinic, patients can obtain applied Thai traditional medicine services, which are suitable in the primary care system. So, the services are collaboratively developed together with the primary care units of Siriraj Hospital, and patient care is provided in collaboration with modern medical doctors. At present, applied Thai traditional medicine is an option in medical services in both reactive and proactive manners. The pictures being seen now are outreach services in the community by students and personnel of the Applied Thai Traditional Medicine program. Their services are part of the home visit team's duties, which include the provision of follow-up services at home of the patients who have visited the hospital. It is the application of both Thai traditional and modern medical principles for all the people with more medical and healthcare options. Suchira Tatong, patient. I suffered from ischemic stroke, a kind of cerebrovascular disease, and was unable to walk. I was hospitalized for 1 month. Now I can walk. I am glad and happy to have a team of applied Thai traditional medicine doctors come to visit me at home. The team gives advice on self-care, nutrition, and exercise. They do not abandon me and give me willpower to exercise and help myself. This is an example of the development of medical and health services and research to help the healthcare needs and better quality of life of the Thai people. It also aims to provide the people with access to medical services in a rapid, modern, quality, safe, equitable, and thorough manner, in line with the established standards, as here is a hospital of the country.